Good morning, everybody. I'm Dr. Jyoti Patel. Welcome to my Facebook Live on gut healing this morning. I practice internal medicine and pediatrics, and I'm also board certified in integrative medicine. So this morning's talk is focused on the digestive tract. Again, a lot of people have abdominal pain, cramping, bloating, constipation, diarrhea. And they're always looking for natural remedies to help them with their digestive tract. So that's what we're doing this morning. So welcome. So to get started, I just want to let you know that my intention today is to provide information. It's not to get into a treating relationship with anyone. I really encourage everyone to talk to their doctor about the talk today and what they've learned and incorporate it into their daily lives. In addition to seeking professional medical care, because if you have serious digestive issues, you should go see a specialist. You should consider getting an endoscopy or a colonoscopy or doing tests such as blood tests and stool analysis to make sure we know exactly what's going on. So integrative medicine is integrating both natural treatments, alternative methods with traditional medicine. So that's what we're going to talk about today. So just to give you an overview of what today's talk is going to be, I'm going to hit 6 things. So we're going to talk about environmental toxins that you're getting through your food, soil, and water. We're going to talk about medications that might be causing problems with your digestive tract. We're going to talk about food and what to do with it. We're going to talk about herbs, spices, supplements that people are interested in. And mostly I want to talk about mind-body work because there's such a big connection between the brain and the gut. So just know that we're going to cover all these topics this morning, so stick with me. Give me a thumbs up or a heart if you feel like these are things that you want to go over, and don't hesitate to comment during the session so that I have a chance to answer your questions, which is my favorite part. Okay, so to get started, we're going to talk about environmental toxins. There are 80,000 different chemicals used in the U.S. We're exposed to chemicals all the time. When they've done samplings of umbilical cords in neonates, they found 232 chemicals that the fetus was exposed to in utero even before being born. So you can imagine how toxic our environment is these days. And when you go in and you do fad detoxes, you go in for a day and you get an infusion, or you go on a week fast, you're really not getting the proper detox. You're just getting a short fix, and then you're going right back into your toxic environment. So what I want to teach you today is how to stay clean. Not just get clean for a short period of time and pay somebody a lot of money, but to stay clean with nutrition and also be mindful of what you're putting into your body. So there are top 4 things that I'm going to talk about. Detoxing chemicals. So think about heavy metals, plastics, plasticizers, phthalates, pesticides, antibiotics, hormones. That's what I'm talking about when I say detox from chemicals. So there are simple ways that you can do that. Start by the low-lying fruit. So you know these things. If you know that the food that you're consuming or the product that you've been consuming has a lot of chemicals in it, you see it on the label, you don't know where the food came from, it came from a fast food restaurant, or you bought it at a county fair, or you got it off of a shelf and it's been there for a year, know that these products probably have a lot of chemicals in them. You probably don't want to eat that. So start there. Start cleaning out your pantry, start cleaning out your fridge, start looking at labels, turn it around. Take a look at the ingredients. If you can't pronounce it, you shouldn't be eating it. If you can't find it in your pantry or in your fridge, and you wouldn't cook with it normally, then don't consume it. So all those products that we have in our pantry, everything that we have in our fridge, if you can start reading labels and reading the ingredients, then that's the first step I want you to do, is detox your pantry, detox your fridge. If you can't find it in your fridge or pantry, you can't make it yourself, or you can't pronounce it, it's got to go, okay? So these are simple things you can do. Second is limit your consumption of food that's outside the home. So if you are somebody who likes to eat out a lot, try to find cleaner greener restaurants to eat in, because the food that is prepared in these restaurants sometimes is the lowest quality, cheapest product that they could buy from the retailer. So remember, even if you're buying salmon, they're not buying the wild-caught salmon. They're buying the farm-raised salmon. So be mindful that when you eat out, they're not always providing you with the best quality food. They're also dousing it with a lot of flavoring, and not the best kind. Hydrogenated oils, high fructose corn syrup, things are added to your food to make it taste more flavorful, including MSG. So be careful about eating out. So cleaning out your pantry, avoiding eating out if you can, reading labels and getting rid of things you can't pronounce. And then the last thing I want to tell you about chemicals is when you see something that says fat-free, or you see something that says sugar-free, or has all natural flavorings or colorings, just remember that's just a marketing ploy. A lot of that stuff is just chemicals added to give you flavor back in some other form. So there's no such thing as a free lunch. If it tastes too good to be clean, and you think that they're adding something else to it, they probably are. So remember, even artificial sweeteners destroys your microbiome in your gut. So your diet sodas, your diet drinks, your sugar-free substitutes, they have to go if you want to heal your gut. So start with yourselves, start with your pantry, start with your fridge, read labels, remove things that you can't pronounce or consume. Get rid of things that you know have already been on the shelf for an extended period of time because they have preservatives in them, and these are going to destroy your gut microbiome. So let's start there. Okay, any questions about chemicals and preservatives? I didn't talk about the food industry, but you all know this, and there's enough documentaries out there now to open our eyes to the commercial farming industry, and we know that animals are injected with antibiotics. When we consume these animals, we consume the antibiotics. They're injected with hormones, and when we consume these meat products, including the dairy and the cheese, we're consuming a lot of these hormones as well. So be mindful that what you eat, what they eat is what you eat. I tell this story often in the office, and I'll share this with you. I met with this lady from Wisconsin, and she was a farmer, a commercial farmer, and she grew corn and soybean. And I was curious, so I asked her, I said, does your family consume the corn and soybean that you produce on your fields? And she said, no, we don't. And it was clear she confessed they spray this crop with heavy amounts of organophosphates, pesticides to keep the crop viable. They also have to use certain types of genetically modified seed to keep this crop in full production. And so I asked her, I said, where does this crop go? Where do you sell your corn and soybean? And she said, we sell it to the animal industry. That's their biggest consumer. So remember that these crops that you might not feel like you're consuming, you're very good about looking at GMO and you're buying gluten-free, but then you're consuming animals that are not gluten-free and are consuming this heavily pesticided, heavily sprayed crop, you're still consuming it. So that's an important point that you have to kind of pay attention to. And so when she confessed about where this crop goes to, she did say that she has a turkey farm, we'll call it a farm, next door. And when they went there, they saw the health conditions that these turkeys were kept in, and the formaldehyde and the chemicals and the feed that was thrown right into it. She was, her husband was actually mortified that that's how these animals are kept. And so when we consume these animals not knowing that they are also consuming a crop that was not kept in a very good condition, we're actually producing a lot of toxins in our system. So to detox, don't just go to a fad detox clinic. Start looking at your pantry, your fridge, analyze where your food came from, where they have been fed, how they've been fed, and then make some choices as far as what you're going to put in your mouth. Okay? Okay, so that's chemicals. Medications. So there are 3 main medications I want to hit this morning that can affect your gastrointestinal tract. First is obvious. It's antibiotics, right, guys? We all know that antibiotics kill not just the infection that it's trying to kill, but all the good bacteria that's in our system. We are covered in bacteria from top to bottom. On our skin, in our nasal passageways, in our mouth, in our GI tract, everywhere we have bacteria that actually live with us. We have more bacterial DNA than we have human DNA. So when we consume antibiotic after antibiotic, thinking that we're doing ourselves some good, we're actually destroying our friends, our partners in crime, our bacteria that are keeping us actually healthy. So be very cautious about taking antibiotics all the time. If you have a cold, if you have a flu, question whether an antibiotic is really going to do it for you. Talk to your healthcare provider. Set the tone when you walk in. Say, hey, I'm not looking for an antibiotic, but tell me what I really need. And then that puts that provider at ease, and then they are less apt to write you a prescription for an antibiotic if they don't think you're expecting it. So I know it sounds silly. You think the provider would automatically not give it to you if they don't think it's important, but a lot of times providers will give an antibiotic because they think that that's what the patient is expecting to get. So start the conversation on your end by saying, antibiotics may not be necessary and I'm okay with that. And if you do that, then you'll save yourself a lot of grief in the future with your gastrointestinal tract. I talk about that with my parents all the time because you can't imagine how many kids get antibiotics on a regular basis, time after time after time. It's not only destroying their gut and their ability to digest, but their future health. It's also making them resistant to organisms in the future. So as parents, I also want you to be careful about how often you provide your child with antibiotics and use it diligently when it's necessary. Second, proton pump inhibitors. A lot of people take proton pump inhibitors, which are acid reflux medications, and they are necessary. So talk to your doctor if you have acid problems because you might need them. But proton pump inhibitors have come under fire lately. These are things like omeprazole, Nexium, Protonix. They've been linked to dangerous infections like C. diff, like SIBO, which is small bowel intestinal overgrowth, like pneumonia in elderly patients, renal failure. Also, it blocks the absorption of important medications like Plavix. So that's also another reason why you have to be cautious with taking these kinds of medications because it might decrease the absorption of life-saving medications like Plavix that are given to patients to stop them from having a stroke or a heart attack. So we as physicians need to be careful, but patients, I also want you to be aware that these medications might be problematic for you. So ask your provider if you must take it and if there are any natural ways to get around it. The last medication I want to talk about is anti-inflammatories. Things like ibuprofen, Aleve, Advil. They're taken as painkillers, they're taken as fever reducers, but sometimes people take it chronically and they take it all the time for their pain and inflammation. Rather than tackling the reason of inflammation, they keep taking these anti-inflammatories to mask their pain. But here's where the problem lies. It erodes away the lining of your gut, so you're more prone to getting gastrointestinal bleeds, you're more prone to getting gastritis, abdominal pain. So if you are taking Advil and Motrin and Aleve for chronic periods of time, maybe seek counsel from your doctor to see if there's anything else you can take that might not be so bad for your gastrointestinal tract. Okay, so detoxing from chemicals, detoxing from medications. The next thing is detoxing the mind. I am a huge fan of teaching people the connection between the mind and the body. There is a lot of studies, strong evidence to show the brain-gut connection. And we have these sayings, I have butterflies in my stomach, I have a gut feeling. What happens when you get nervous, you get queasy? It's because there's a direct bidirectional tract between your brain and your GI tract. It runs right up and down. It's the vagus nerve, it's the autonomic nervous system. It conducts messages up from the gut to the brain and down from the brain to the gut. So when you are mentally stressed from work, from toxic people, from social media, from being on technology for too long, not being in nature, not sleeping, not exercising, all that stress actually translates through the autonomic nervous system. The vagus nerve sends signals to your digestive tract to increase inflammation. And yes, the problem is always inflammation. That's where everything starts. And so then that causes gas, bloating, indigestion, constipation, diarrhea, cramping. not feeling good, fatigue, weight gain. All of that comes from that disruption in that mind-gut connection. So there are a few things that I want to talk about with that. So how do you get around that? So the first thing is, detoxing from toxic people and media, like we talked about. Second is making good connections. Surround yourself with positive people. If you're around good, positive people that bring you up, your mind feels better, your gut feels better. Okay, so positive people, positive community. Find a sense of purpose. If you don't have a sense of purpose in this world, you'll find yourself lost, and that also causes stress, and that can also cause you to have more gastrointestinal symptoms. So find a sense of purpose. Give back to your community. Make your life more meaningful by surrounding yourself with positive people and positive friends. Practice gratitude. A lot of times we forget to be grateful for the things that we have, and we struggle with negative thoughts, negative emotions, negative self-talk, and that can have a negative impact on your gut. People have acid issues, they can't sleep at night. People have irritable bowel syndrome, they have diarrhea and constipation, they have chronic abdominal pain. This all comes from those negative thoughts, those negative toxins. So remember, negative mind, negative body. I teach people a lot of things when it comes to food and mindfulness. So let's talk about that. Food is always a source of our suffering, and it shouldn't be. It'd be a source of nourishment and joy. So sit in front of your food, take a deep breath before you start your meal. Use all 5 senses: sight, smell, taste, sound, feel. Get in touch with your food. Appreciate it. Sit at a table. Don't sit in front of the television when you eat your food. Pay attention to each bite. Savor each bite. Enjoy your meal with people that you love. Make food a positive experience. All of these things can help with making yourself healthier on the inside. The food that nourishes you will help you. Thank the food. Thank you for nourishing me. Thank you for healing me. Thank you for keeping me alive. And that way you're not finding food to be the enemy. You're not feeling guilty. You're not creating negative emotions around food. So remember, the mind-gut connection is really important. There is such a thing as visceral hypersensitivity, and that's actually a condition that people have. Their gut has become so sensitive that it is constantly in distress because the mind is in distress. 90% of your body's serotonin is produced in your gastrointestinal tract. We think of serotonin as a brain chemical, but only 3% is made in the brain. 90% of it is produced in the gut. So if you heal your gut, if you heal your mind, you'll heal your gut. It's all connected, okay? So if you have any questions about mind-body stuff, let me know. I love it. Okay, so the next thing, so we talked about chemicals, we talked about food sources, we talked about medications, we talked about detoxing the mind. Okay, we'll get to the meat of the matter, nutrition. The nutrition part of the gut, I'm a big fan of saying don't go on a diet. Every person is different. Everyone's nutritional needs are different. Listen to your body. What does your body need? Nourish your body with the right foods and then work backwards that way, okay? So when it comes to food, sometimes people have food allergies and food sensitivities that might be causing them GI distress. So even healthy food might be a problem for you. So first go to your doctor, see if you can get tested. Maybe you have celiac or you have food sensitivities or you have food allergies, and you can get tested for that and make sure that you're on the right path. But let's say you don't have that. You don't have a physician that can help you with that, and you want to try to see what you need to do to eliminate foods that might be causing problems. Well, there are 2 really good, strong evidence-based elimination diets that I'm going to talk about today. First is called the FODMAP diet, FODMAP. You can look it up. Strongest evidence is in irritable bowel syndrome. There's some good evidence with inflammatory bowel disease as well, like Crohn's and ulcerative colitis. So if you do suffer from diarrhea, gas, bloating, cramping, constipation, and distress in your bowels, think about FODMAP, FODMAP. You might say, well, what the heck is that? It's removal of fermentable monosaccharides and polyols. So things like, the simple things I'll tell you are lactose, which is highly fermentable, wheat, which is highly fermentable. certain fruits and vegetables that produce a lot of fermentation, also foods that have a lot of water, they absorb a lot of water. Also, these foods don't break down very easily in the small bowel, so they really can cause havoc in the GI tract. So you might not be allergic to these foods, but elimination or starting with elimination of these foods might help you get started in healing your gut. So FODMAP, F-O-D-M-A-P. The other elimination diet that was tested was MEWS, M-E-W-S. For you cat lovers, you'll remember MEWS. So it's milk, eggs, wheat, and soy. So they did a study based on the elimination of these 4 foods, and that was equivalent to the FODMAP in terms of helping with irritable bowel syndrome. So if you do have some of those symptoms, think about FODMAP or think about MEWS to get started in a simple elimination diet. If you're tech savvy and you want to have an app to help you find those FODMAP, low FODMAP foods, there is, just look this up. It's Monash University Low FODMAP Diet App. I know it's a really long name, but Monash, M-O-N-A-S-H, University. They actually have an app for low FODMAP diet, so you can follow that. Okay, so elimination diets are really important. Again, I always tell people, it's simple. That's right, Michelle, Monash. Eliminate the things like processed food, high sugar foods, artificial sweeteners, hydrogenated oils, pesticides, preservatives, dyes, chemicals. You know, a lot of places have now come under fire, like General Mills and Starbucks, to try to clean up their diet. Even Kraft Macaroni and Cheese is starting to look at the BPA content in their powdered cheese to try to remove a lot of these chemicals from your diet. But definitely you want to, if you're trying to do an elimination diet, that should be the first thing you get rid of, is the processing and the dyes and the chemicals and the additives, okay? Let's see, with pediatric patients, because I was asked by a mom to include pediatric patients into my talk. With pediatric patients, the highest amount of BPA is found in children's formula, infant formula, and also when you look at jarred food, high levels of heavy metals as well in jarred food for infants. So just be mindful about where your food sources come if you are having to resort to formula or if you're having to resort to jarred food. Because they can be introduced, a lot of heavy metals and BPA can be introduced to them. Also, a lot of toddlers eat mac and cheese, or they eat processed grains like cereals. And remember, these cereals are processed through the belts that have rubber and plastic, and these cereals are coming into contact with a lot of chemicals as well, so be careful about the large amounts of chemicals they're exposed to with cereals and processed grains. Okay, so food elimination, food allergies, food sensitivities. What should you add in? I know I talked a lot about removal of stuff. What can you add in? So I'm a big fan of spices and herbs. So we're going to talk about that next. My next favorite topic. Okay, so what are my top favorite spices, herbs, and supplements for different food conditions? Okay, so number 1 is always turmeric, right? I talk about turmeric a lot. Turmeric is a yellow spice. A lot of Indian food contains turmeric. But why do I recommend turmeric? So there were 3 really great studies done on ulcerative colitis, which is an inflammatory bowel condition that causes tremendous amount of distress and problems for patients. But they found that it actually helps reduce and puts symptoms and also puts them into remission. So there was one particular trial that I looked at that I thought was wonderful. It was a randomized controlled trial, double-blinded, and they put patients that had ulcerative colitis on mesalamine, which is a medication for ulcerative colitis, and they added 3 grams of turmeric to their diet. They found in 4 weeks, there was a 54% reduction in their symptoms and remission rates in these ulcerative colitis patients when they consumed turmeric compared to placebo. So, you know, again, if you know somebody who has inflammatory bowel disease, maybe a trial of turmeric would be warranted for them. Now, we always say put turmeric with black pepper, but in ulcerative colitis and GI symptoms, you don't need to do that because it's actually a topical benefit that they're getting from the turmeric. So they can just add it to their meal, okay? So turmeric's one of my favorite go-tos. All right, what else do I have? I have a lot. What should I say? So we have ginger. Ginger is a huge one for me for nausea, for gastroparesis, for overall GI health, but also inflammatory health. So add ginger into your meal plan. Okay, so irritable bowel syndrome with diarrhea. There are two big ones that I recommend, caraway seeds and peppermint. So I love caraway seeds. I add it into my sauerkraut with every batch. And if you like peppermint and you have irritable bowel syndrome, really good. Some good studies. They even make peppermint capsules now that are available, even prescription ones, to help with irritable bowel syndrome. So, again, peppermint's a great thing to grow in your garden. Add to your tea, add to your meal, but also you can take it as capsules if you want. So irritable bowel syndrome with diarrhea. Irritable bowel syndrome with constipation, my go-to, flaxseed. Flaxseed, by far, is a great source of omega-3. It's a great source of fiber. Add it to your shakes and your smoothies and your salads. But if you're really not a fan of that, you can also buy it as a supplement. Liver. So a lot of people have fatty liver. They're told by their doctors they have fatty liver. I tell them add in two things. Milk thistle. Again, great studies to show that milk thistle can help with alcohol-related hepatitis. So I recommend milk thistle as a detoxer. And dandelion. Dandelion tea is excellent for the liver. So you can add that in, and apple cider vinegar is always a favorite. Those things are great for the liver. So think about those three things if you have fatty liver or liver issues. Let's see here, reflux. So acid reflux. Patients of mine are always coming in. They're on proton pump inhibitors. They want to know what they could take that's natural to help decrease heartburn or gastritis. I usually recommend diglycerated licorice root, 300 milligram chewables. I recommend adding in slippery elm. I recommend adding in marshmallow root. I love fennel for that as well. Speaking of that, we talked about detox from chemicals at the beginning of the talk. Think about fennel and coriander. Those are really good to help detox from heavy metals. So unless you don't like coriander, some people have that soapy, 12% of the population have a soapy taste in their mouth when they eat coriander. But if you do like coriander, throw that into your salsa, throw that into your curries. Coriander is a great detoxer. Cheryl has a question here. How much turmeric should you take? I started turmeric last week after your talk. Want to make sure I'm taking the right amount. Good question. So again, from a diet perspective, which I'm a foodie more than I'm a supplement person, about 1/8 of a teaspoon of turmeric added to your meals daily is a great idea. That also, is great. It's great for soups. It's good for curries. It's good for eggs. You can add it to anything. But let's say you're not a curry fan or you're not a turmeric fan, and you wanted to take a supplement. The studies that were done on the ulcerative colitis patients were 3 grams a day, but the last week's talk on arthritis and inflammation, the studies that were done on rheumatoid arthritis patients was about 1,200 milligrams a day. So I think depending on the condition, you could take anywhere from 1,000 to 3,000. And again, some people don't tolerate that much. They can have more, a stomach upset from just taking too much turmeric. So maybe you play with that, start out with 1,000 and see if you can titrate up based on how well you're doing. I have another question. It says here, super bio curcumin 400, same as turmeric? Yes, so curcumin is the active compound in the root turmeric. So turmeric looks like ginger. It's a root, and when you cut it, it's orange, not white on the inside. And the active compound is the curcumin. So if you are looking at a supplement and it says curcumin, that is basically turmeric. So that's equivalent. Okay, here Alice asks, fresh turmeric cooked with ginger, how much? You know what? I love fresh ginger and I love fresh turmeric. If you can actually get them, about 1 inch is a good amount. Too much ginger can sometimes be a little spicier for some people. So if you think that that's too much ginger for you, maybe you do start with 1/4 inch and work up to a full inch. But about 1 inch is a good amount. Same thing with the turmeric. If you're juicing, let's say you're juicing or you're putting it in your Vitamix to make a smoothie, maybe start out with 1/4 inch of both, see how that flavor works for you, and then work up to more if you can tolerate it. Okay, so good questions. Thank you. Keep the questions coming. I love answering questions. All right, so where are we on that? Okay, so we talked about the supplements. A big topic that people always ask me about is probiotics. Should I take a probiotic? Which probiotic should I take? Again, I'm a foodie. I recommend getting your fermented food in first. I make my own sauerkraut in my pantry, and then I transfer it to the fridge. So I'm getting fresh sauerkraut on a regular basis. You can even make your own yogurt. And that's also a good way of getting good probiotics if you are including dairy in your diet. You could do kombucha. Yes, Michelle, you can do kombucha. You can buy the commercial stuff, or you can make your own. I talked about this a little bit last week with the arthritis talk. You have to just be careful if you're making it yourself. You want to get the Scooby from a reputable source. You want to make sure that you are watching your kombucha so it doesn't get slimy and pink, because that's not really good stuff. You want to make sure you've got a good quality kombucha. But it's pretty easy to make once you make it once. You've got, a lot of Asian food is fermented. So you've got kimchi, you've got natto, you've got, fermented tofu, which is tempeh. You could also do kefir, my husband says, kefir. So you could do that, and that helps with restoring your gut microbiome. Now here's a little tip though, guys. If you are doing the FODMAP diet, you're doing an elimination diet, you actually aren't going to do a bunch of probiotics at the same time. My steps for restoring gut balance is to first do the elimination for at least 6 weeks, clean out all the junk that's in your bowels, clean out all the fermentable food from your bowels. Once you've done that and you've tried to do a reintroduce or re-challenge, then you might want to introduce probiotics and probiotic food. And then you want to introduce prebiotics like ginger, like garlic, onions, artichoke, chicory root, inulin. These are prebiotics. Prebiotics are foods that the probiotics like to eat. So bacteria love these kinds of prebiotic food. But if you introduce them too soon, a lot of people will find that they actually get more bloated, more gassy, more discomfort. So it's a step fashion. So working with a skilled provider is really important, okay? So you first do your elimination. So let's say you're taking medications that are bad for you, like a PPI, and you're trying to wean. First do the PPI wean. Then while you're doing that, go on a FODMAP diet, do an elimination diet, clean your bowels, get rid of all that toxic stuff, waste that's been sitting around, fermentable foods that are making you sick. You might even want to do supplements to help clean up some of the infections that might happen. We'll talk about SIBO in a minute. Then once you feel better, then you introduce probiotics and prebiotics. So that's usually the pattern that I recommend. So if you are going to take a probiotic, you don't like fermented foods, it's not in your palate, you just want me to recommend something good for you. Studies show that if you have ulcerative colitis or you've had C. diff, the kind of organism that helps with that is Saccharomyces boulardii. In the United States, there's a brand called Align, which is the Saccharomyces organism. That's been shown to help with people that have ulcerative colitis, Crohn's, or have C. diff. So I recommend that one for it. If you are looking for specific diseases and specific probiotics, I recommend you go to usprobioticguide.com. usprobioticguide.com. It has a spreadsheet. It gives you the conditions and the bacteria that works against that condition. So it'll give you certain brand names, and I'm not promoting any brand names because I'm not affiliated with anything, but if you go to that website, usprobioticguide.com, it'll actually show you which condition matches with what probiotic in case you're interested in that. So that's a resource that I can recommend. Okay. Oh yes, I was going to talk about SIBO. So SIBO, most people have heard about SIBO. It's small intestinal bowel overgrowth. It's not uncommon that people that have taken a lot of antibiotics or on acid-suppressing medications have an overgrowth of yeast and bad bacteria in their colon. So no matter what food they eat, they have problems. They can drink water, they can have soup, they can have vegetables, they can try a healthy diet, and they still have a lot of gastrointestinal problems. And this is an ongoing concern for people that have these gastrointestinal problems. The best way to test for SIBO is a breath test. You blow into a chamber, they test for fermentable gases, and if you come back high on those gases, you might have an overgrowth of fermentable bacteria in your small bowel and may require medical treatment with specific types of antibiotics to get rid of that infection before you get started on everything else. FODMAP diets are great to do if you have small bowel intestinal overgrowth. Okay, so just to recap, we talked about removal of chemicals from your food sources, from your soil and water. We talked about medications that can interfere with your gastrointestinal health. We talked about elimination diets and foods that can help, spices and herbs and supplements that I recommend, and then probiotics and certain infections that might be causing your gastric distress. If anybody has any further questions in regards to anything specific, like acid reflux or irritable bowel syndrome or diverticulitis or anything like that, please don't hesitate to ask me questions. If not during the talk, then make comments below and I'll do my best to answer those questions. Thank you for joining me on Saturday morning for this Facebook Live on gut inflammation. Next Saturday, I'm going to address the mind, and we're going to do a talk on memory and focus, attention, ADD, and I'm going to talk about the spectrum of kids to adults in terms of cognitive function. So if you're interested in cognitive function and improving it, join me tomorrow, not tomorrow, next Saturday at 10 o'clock so we can go over that. Karen does have a question. She said, do you offer any special testing in your office? And we do for our patients. We do have testing for allergies. It's an ALCAT study, A-L-C-A-T. Ask your doctor for that. It tests for 300 to 600 different food allergies, spice allergies, additive allergies, antibiotic allergies. It's an excellent test. We also do a micronutrient test, which tests for 33 different deficiencies in minerals and vitamins and nutrients. We do a comprehensive stool analysis, which is by Genova Labs, that tests for your microbiome to see if your microbiome is healthy or not. It tests for infections, if you have parasites or you have overgrowth of bacteria. It tests for celiac, H. pylori. It tests for malabsorption and inflammation in the gut. We do genetic testing as well, so that if there's any specific conditions that you might suffer from, we can test for those as well. Bubba asks, are we accepting new patients in our clinic? At this time, we're actually closed to new patients because we are in the middle of winter and it is a full clinic for me. But we will be opening up again in the spring as we start to see some openings, so stay tuned to that. Please reach back to us in the spring. If you're interested in more of an integrative consult, we do offer integrative consults on the wellness side, which isn't the practice, but it does give you a 2-hour consultation to go over your personal history, your health conditions that you're worried about, and optimizing your wellness, anti-aging. We talk about supplements and nutrition during that consultation, but that is not part of the practice. It's actually part of our wellness center, and we are taking patients on that side. Okay, good. Well, Michelle says she needs the talk on the cognitive function, so hope to see you then. If everyone's good, I will cut out now and head over to the community garden for some volunteer work. Hope to see some of my locals there. Have a great morning. Bye-bye.